apa?
Ali.
Okay, alright. Patient is mobilizing, airway is intact. I'm going to complete my airway assessment. Is there any blood or foreign body in the airway?
No.
Is there any gurgling or stridor?
No stridor, no gurgling.
No stridor, no gurgling. Is there any maxillofacial deformities, any external wounds?
No.
Okay. The measure the required height of the cervical collar from the base of the neck until the imaginary line of the chin. So I'm going to before that, is there any catastrophic bleeding?
As you can see,
Okay, exposed tak ada. Okay, right. I'm going to put on my cervical collar. Okay, switch to the forehead. Boleh? Alright, airway maintained, cervical is clear. Next, I'm going to move on to breathing. Zakwan, right now, can you put on vital sign monitoring? Put the patient cardiac monitor juga. Is the patient tachypneic?
not technique.
Can I have my RR and SpO2?
R 18, SpO2 97%.
97%. Okay. Is there any open chest wounds, chest injuries?
To inspection, there is no abrasion, no wound seen.
Okay, chest entry is equal. Is my trachea central?
Yep.
Trachea central on percussion is entry equal?
Equal.
Sorry?
Equal.
Equal entry on auscultation is the entry equal?
Entry equal.
Entry is equal. Okay. Breathing is maintained. Next, I'm going to move on to circulation. Dah pasang vital sign monitoring. What's my BP heart rate?
BP 80/55, heart rate 125.
Okay, patient is hypertensive. Please set lah 2 large flow granular.
Alright.
Lepas tu make
Large
sure
flow
run
granular
1 liter of warm cell line. Send for trauma blood panel. FPC, RP, LFT, coax. Send for cross patch juga. While running fluid bolus, I'm going to assess from the CCTVR. How's the pulse volume?
Poor pass body.
CRT?
Delay.
Temperature?
7.
Okay. Patient still in shock. Next, I'm going to assess for my sign of shock. Is the pelvis tender or any deformity?
No tenderness on pelvic.
Any stromal hematoma?
No.
Is there any scar, any injury over the abdominal wall?
No.
On palpation, is there any tenderness or guarding?
Tenderness on slight palpation over the right upper quadrant.
Okay, okay. Masa nak tunggu ni kita ambil ultrasound machine. I'm going to do my primary adjunct lah as and when it is available. Suspected intra-abdominal injury. Lepas tu any long bone deformities. Boleh angkat tangan dulu belah. Any long bone.
Able to move both hands.
Okay, dengan kaki ada sakit kat mana-mana ke?
No.
Okay. After my 1 liter warm cell line bolus, what's my BP heart rate right now?
Maybe the same.
Okay, bagi transfusion 1 gram stat, lepas tu kita
Alright,
transfusi
have you
CFO.
been given CFO available for transfusion?
Okay, masukkan CFO, lepas tu after my CFO, I'm going to reassess the patient's hemodynamic status. What's the latest BP heart rate?
Remain the same.
Patient still in class 3 hemorrhagic shock lah. So kita alert MTP, activate MTP. Lepas tu make sure to avoid the little triangle juga lah nanti. Okay, MTP started. Then I'm going to do damage control resuscitation, aiming for permissive hypotension. Set a SPP of 80 to 90 with MAP of 50 to 60. Turn MAP. Then we can activate tier 2 trauma team juga lah. Next, I'm going to move on to my disability. Cik, nama siapa?
Ali.
Okay, cik tahu sekarang kat mana ke?
Hospital kot.
Okay, hospital. Betul. Sekarang ni tadi siang ke malam?
Siang.
Okay, alright. Tadi dah OB command, GC is full. I'm going to check my pupils.
Equal reactive bilaterally.
Okay, DXT.
XD8.
DXT 8, okay. Disability covered. Next, I'm going to go on to exposure lah. Going to do a back swipe. Is there any blood?
You can see any blood.
Okay, no blood, no blood. Lepas tu, do I have enough manpower for a 30 degree tilt?
Yeah.
Ada. Okay, so
What do you want to do?
30 degrees tilt to check for stability deformity.
Okay, done that. Negative.
Okay, negative. MTP. My latest BB and heart rate after starting MTP.
88 over 50.
Okay, over 50. So acceptable systolic blood pressure. Tier 2 traumatic is activated. Next, I'm going to proceed to my primary adjunct. I will order a chest X-ray, pelvic X-ray for the patient. I'm going to also picture the bloods are sensed, trauma blood panel, NPC, co-ed, blood gas. Dengan ECG lah. Then with my EFAS.
Okay, there's a positive intraperitoneal free fluid in the Morrison area.
Okay, so this patient is currently in post-NDA in grade 3 hemorrhagic shock, secondary to intra-abdominal injury. So I am going to continue my damage control resuscitation. I'm going to alert surgical team for emergency laparotomy in view of unstable intra-abdominal injury. Exposure. Then meanwhile, I'm going to make sure the patient is put on thermal blanket. I'm going to give calcium gluconate supplement as patient is having MTP and massive transfusion. Then normotherapinya, I'm going to keep the patient MDM on aggregate maintenance. In a given. Lepas tu bagi tranexamic acid 1 over 8 hours juga.
Okay.
Then after that, I'm going to ada masa lagi, I will proceed with my secondary survey lah. I'm going to check head to toe for any other injuries missed, any potentially life-threatening injuries lah, any scalp laceration, any injuries of the head.
Are you done?
Okay, done.
Okay, thank you. So you have another 30 seconds to go. Okay, comment? Comment?
Soalan apa? Kan patient datang.
Komen, soalan.
Komen, okey. Good flow,
You bagi dia makan berapa? First floor.
9.
Okay, alright. Why not 10?
Sebab saya rasa ada satu yang saya nak tanya soalan.
Yang dia tak buat kan? Apa?
Sebab memang patient tak ada pelvic bony tenderness. Tapi kalau yang saya tanya, saya punya sini baru pergi apa nama TLSM baru, apa-apa BP tu dia akan
Lebih banyak.
apa nama striker dengan pelvic bender sampai buat pelvis X-ray clear baru boleh off.
Okay. You can do that, but there is no marks for that. Tidak ada dalam skema. You can do that. Tak ada siapa penalize you. But kalau you spend too much time to putting this pelvic binder, you tak sebab apa benda lain, dia jadi rugi balik lah. But you can do that. Okay. Sorry. Ada apa nak sebut nak main?
The EFAS.
Okay. He requested for IFAS.
He requested.
Dia
requested.
Dia lambat sikit.
That's what I mentioned. So they complete all the primary, then they buat adjunct to the primary. Sama ada you nak buat macam tu pun boleh, ataupun you nak buat straight away when you go to the C, you nak order for order pun boleh. Tak ada masalah. Now IFAS tu dah termasuk kan, walaupun it's still adjunct to the primary survey, but sometimes they incorporated in the primary survey. Tak ada issue. Okay, I give you 9. One, in fact you answer everything. Everything in the schema, semua useful. You initiate fluid resus, then you transfuse SAFE-O, you bagi tranexamic acid, you activate MTP, you buat permissive hypertension, it's mentioned here. And then you refer surgeon. Cuma you tak sebut for DCS lah, for possible emergency laparotomy, but it's okay. Apa nama, why 9? Why not 10? The showmanship, lacking of showmanship. So by right, when you go through the C, A, B, C, D, every step tu you show you properly do it. Inspection, palpation, percussion, auscultation, buat betul. Bukannya buat inspection, palpation, habis, tak ada. all steps tu mesti you do it fully. Okay. Then you palpate the abdomen. Show us that you palpate all the non-quadrant of the abdomen. You do the gentle palpation for the pelvis, thorax. Yeah. Look for the long bone fracture. Look for the. You make it everything looks very convincing. Baru you dapat.
Kita akan finalize ke kalau move on DP tak stabilize lagi, move on to D while waiting for the SAFO ke terus kita kata
Once you found the problem, treat straight away.
dah treat dah kata bagi SAFO. Lepas tu tadi
mana?
I went to D first before while waiting for the SAFO to habis. Ke nak cakap SAFO dah habis my latest BP.
Tak ya. Okay.
Kalau you for example in this case we got the intraabdominal injury kan. So let's say we suspect of tension pneumothorax for example in the duration of 8 minutes. So are we expected to proceed for chest tube insertion or we can mention
Then kita kalau perlu buat, kita akan cakap kena buat. Nombor satu, bila you masuk station tu, make sure first 30 second you have a very good high burn. Okay, tengok apa sebenarnya ada. Ada tak dua? Ada tak satu benda macam tu? Satu
okay.
Takkan dia tak dalam tu. Maksudnya mesti you kena buat. Ataupun satu patient macam ni, satu airway punya ni, mesti you kena do something about the airway. Tak kisahlah sejenis airway ke ataupun intubation ke apa ke. Usually roughly itu dulu you dapat gambarannya. And then you have to manage accordingly. Let's say in that case you diagnose as tension pneumothorax. So you say I would like to perform needle thoracocentesis. Then kita akan lead you lah. Kita akan kata okay, this is the patient. Can you perform needle thoracocentesis here? Then you